got our very own doctor who's been on the front line herself, Dr. Larissa Corder, now joins us. Good morning, Larissa.
Morning,
you are on the front line. What's your experience of PPE availability?
I think we've all heard and are well aware there's national shortages. Thankfully, we have enough in our hospital, especially in our intensive care units where the risk of exposure, it's at its greatest. But as we've heard very tellingly, there are some horrific stories coming out regarding other NHS units just not having enough. And what's more, even outside in the district communities and in social care. And it's so difficult to hear these stories, especially as a healthcare professional myself, to know that there are colleagues that we are losing every single day due to this virus, lives that we shouldn't be losing. It's one thing to not be able to control some of the effects of this virus and to be grappling with dealing with, the serious consequences of treating this disease. But it's quite another where these deaths are actually entirely preventable, and we are letting colleagues go. We've got over 100 healthcare workers who have now died, and one death is awful enough, let alone over 100. It's just completely unacceptable, and it makes me shudder because my heart just goes out to all of those people and all of those families, and knowing that I have colleagues across my hospital and also other NHS units who are pregnant and who have put themselves on that line in immense danger and are exposing themselves to this virus in order to save lives, and they're just not getting the protection that they need.
The figures, because we watch the briefings every afternoon, and you watch people sort of appearing to dodge the questions, really, because the stats that we've been given, and as I said yesterday, you want someone to say, no, that's not the case. Millions of boxes of PPE sat in British warehouses ready to be exported abroad, apparently. One firm in Nottingham, Printers Prime Group, transformed its operation, took on 30 extra staff, ready to make up to 1 million visors a month. That's 35,000 a day. It's already delivered 350,000 to frontline NHS and care staff for free or at cost. But the boss, John Tolley, revealed that they'd been unable to get a big NHS order after investing £250,000 on materials. It looks like, and we were watching Piers this morning on the telly, saying that maybe the military could be more involved here because it's just a question of logistics. This stuff seems to be around, but it's just, it's a massive task. We've never done anything like this before. It's just getting it to where it's needed.
It's a huge logistical operation. It's really difficult to meet, first of all, the supply needs at the moment, and that's in terms of the kits, so the PPE, but as well as drugs, drugs that we're using in intensive care, because all of our intensive care units are full and we're running out of things. So keeping up with that demand is a huge logistical operation. But as a result of that, because this is what I've been hearing too, and I'm well aware, having made inquiries myself, that there are shipments ready to go out. It's just a question of distributing it. So what I've decided to do is actually take some of this into my own hands and try and make an effort, certainly at the local level where I can. So I have actually been in touch with the Duchess of York, who has agreed to help me with this. And together we are actually going to ensure we get these supplies into the country as soon as possible and then distribute them to all the places that actually need them so desperately and where this help cannot get there in time.
Well, that's incredible, and good luck with that.
She's got in logistics. But
I know, but if she can do it, amazing.
Every hand on the tiller helps, for sure.
You know what? Even if it means getting into a car, driving around with my friends, just distributing this stuff to the various hospitals, that's something I'm very willing to do.
Absolutely.
Larissa,
you do believe, on a slightly more positive note, that we could be past the peak of this, and that you are seeing admission rates in hospitals lowering.
Yes, certainly in ITU. I mean, it's still too early to say, but the number of admissions does seem to be reducing. We are seeing some bed availability now, and those beds are being filled, but it's mainly due to transfers between units. So that is a really positive thing. And also in terms of some of the personal stories and cases I've looked after, we really are beginning to see that turn of the tide and patients turning corners and slowly and gradually getting better. So that is for sure. And we're trying to keep spirits up. We're now trying to connect them with their families. Just yesterday, actually, our head of family liaison was going around with an iPad and actually speaking to the families, and was going around showing them the patient who's in ITU and who, of course, in some instances can't even hear them. But it's just so important for families to have that interaction and to understand what's going on and help these patients to heal. So there is positive news coming out of this, but it's very slow and it's very gradual, and we have to be very patient and not take our foot off the pedal at this point in time.
Thank you,
Thank you,
Larissa.
Larissa.
Thank you to you. Thank you to your team. Thank you to the teams up and down the country. Thank you very much. We'll be clapping tomorrow night for everybody.
Yes, we will.
Thank you. Thank you. That means a lot.